Hello and welcome to the talk with Tariro. Today on the program, we are looking at the issue of women living with HIV and COVID-19. How has it been? So we'll really look at the HIV landscape. How is it in our country? And then now we have COVID-19 coming in. A lot of false information has been circulating where people were saying if you are HIV positive, do not go and be vaccinated. So today we have when we are looking at HIV, these are the ancestors of HIV. I have on the program Tendai Westerhoff. She's the Pan-African Positive Women's Coalition National Director. Tendai, welcome to the talk.
Thank you, Tariro. It's a pleasure to be on the show.
Yes. Maybe there might be someone who might not know you, which is highly unlikely. But who is Tendai, and when did she get to know about her status? How has she been living with HIV all these years?
My story has been an open book, and I'm not ashamed to continue sharing it because it's now close to 18 years, and next month I'm celebrating my 55th birthday. So from the time I disclosed my HIV status in 2002, I've walked the journey.
Yes.
And I've walked the journey with the aging pandemic.
Yes.
We have seen it all. We have advocated for treatment. We have advocated for care, for support. We have advocated for inclusion. We have advocated for good health and for everything. And we have seen everything that is happening to people living with HIV in what we call positive health, dignity and prevention, including the emergence of other upcoming diseases such as COVID-19.
Yes.
We are now in that trend as well.
Yes. So when we're looking at HIV, Tendai, people who might be watching, the noise that we used to have, the communication, all messages just talking to people about COVID, about HIV. Sorry, now that shows how much COVID is like now the condition or the pandemic that's on our lips. When we're looking at HIV, we have our own targets as a country. The 90 by 90 by 90, which we said we have achieved. Now we are talking about ending AIDS by 2030. Is it a reality for us as a country and globally?
Yes and no. It can be a reality if we all put our heads together when we, for instance, political commitment to ensure that people who are living with HIV, who need treatment, have access to treatment, then it can be a reality. It can also be a reality if we put up programs, comprehensive programs that protect young people from HIV infection, including women and girls. And it can also be a success if each and every person at their individual level get tested for HIV and know their status. Those who test positive are immediately initiated on treatment. It can still be a reality if every pregnant mother, as soon as they realize that they are pregnant, they seek services, they are enrolled on the EMTC program, including the newborn babies being tested for HIV, including men and young boys being circumcised for HIV prevention. It can be a reality. But it cannot be a reality as long as we still have the big creature which we call stigma and discrimination. I'm not so sure where we are going to get a solution to that. I'll give an example. Even for us, people like us, people see us being strong like this, they think we have managed to beat stigma, but we still experience stigma almost every day of our life. But because we have accepted our status, we are open about it, a person like me has now developed a thick skin. Even where stigma is there, my eyes are now blind to it at an individual level.
But how are people being stigmatized in this era now, Tendai?
We still have people who are still in denial that HIV is and AIDS exist. And we still have people who are still in denial to say if you are HIV positive, it's because we have loose morals, etc., etc. It's a shameful condition. So it is for that reason. And for instance, among the men, if you notice the statistics in the country, more women are living with HIV and more women come out openly, seek services for HIV than men. But for men, they cannot really, we don't really see most of them saying we are HIV positive. If you see a man coming out about their status, it's either he needs a position in a support group or in a network of people living with HIV. They need positions for that, you know. But these high-class men, even policymakers, I was talking with the women last week to say, no, we now need a seat in parliament as people living with HIV, as women living with HIV. And somebody was saying, no, they'll tell you that we have people living with HIV who are also in parliament. But we're saying, no, we never saw them. They never speak about their HIV status as they are speaking about COVID-19 if they test positive now. So the issue of stigma is still a big challenge. And this is why we may fail to end AIDS by 2030. And then there's the second issue of gender-based violence. Even now, before it was more women being subjected to gender-based violence. If they test positive to HIV, they get the blame and they get divorced. And they are blamed by the whole family. But now we have seen the increase of gender-based violence even on men. We are hearing men are committing suicide because something has happened in the family. So we need to deal with issues of gender-based violence, you know, if we want to end HIV by 2030, because there is a link. And there is also the issue of child marriages. You know, it's a big issue. I travel around the country. I would not want to name certain districts, but I've seen that it's a lifestyle for older men to marry young girls, even young women, you know, because those young women are never exposed even to education. They grow up in that small rural environment, and to them that is life, and it becomes a vicious cycle that when they reach the age of 15, 16, 17, 18, they are already getting married, and not even to a man with one wife, but it will be polygamous, you know, relationship. So those are some of the issues we need to deal with if we are to end AIDS by 2030. And another hindrance is this one of creating an enabling environment for key populations. You know, we know that talk really much about key populations. Sex work is happening in Zimbabwe. We are not isolated from any other country. It is a trade that has been there for generations. Even in the Bible, we hear about people called Rahab who were prostitutes. You know, so we need to create an enabling environment for people who are indifferent to access services at healthcare facilities, including for sex workers to accept services, because these sex workers are servicing the the boy dead, married men, and all these others, you know. So we need to really have interventions that are targeting the sex workers and their partners and their clients and create that enabling environment for people to access HIV services. This is the only way in which we can be assured that by 2030, we are ending the bullet of AIDS. And I want people to understand, when we are saying that we are ending HIV and AIDS by 2030, it doesn't mean that HIV will completely go away. But all what we are saying, that every person who needs treatment will be on treatment and their viral load will be suppressed. As a result, they will not be able to infect the next person. Discorded couples too can live together, a positive person and a negative person, as long as one has a viral load and they are taking all the other precautions, condoms, PrEP, eat PEP, etc., etc.
All right.
Thank you.
We will continue with the discussion after the break. Welcome back. We continue with our discussion, where today we are looking at women living with HIV and COVID-19. First segment, we were really getting an understanding and appreciation in terms of Tendai's life as a woman living with HIV and how she is seeing that panning in our country. Tendai, now looking at the issue of COVID-19, how did it impact women, especially women living with HIV?
Women living with HIV were also impacted by COVID-19 like any other members of the society. As you know, when we started the year, things were normal. Nobody knew that by March we'll be experiencing the national lockdowns. And these national lockdowns were not only to Zimbabwe, but I think government had to take steps to protect you and me and to protect everyone. They had to make that lockdown so that it was an opportunity to understand the disease and to protect everyone. So as women living with HIV, we were not spared. As you know, the majority of us are informal sectors. We could not go to our markets. We could not do our business as normal. We were forced, as per the regulations, to stay at home, and movement was restricted. And there was also disruption of treatment because for one to travel from point A to point B or from their home to go and access their treatment, to refill their treatment, they needed travel letters, which were not there, which were difficult to come by. And the transport was also a problem because there were restrictions of how many people were to be carried in public transport. And also much of the public transport was banned. So it impacted negatively on women living with HIV. We saw some defaulting on their treatment due to the lockdowns. And we saw a lot losing their household income because they did not have any other sources of income. And we also saw some of them being exposed to gender-based violence because, you know, they were now staying with their husbands in the home, you know, when a man was used to just come to the house, you know, to sleep and then he goes to wherever he had to go, but they were forced to live together. So it was like starting to know each other, living together. And also that posed a lot of challenges for women living with HIV. Even those who were pregnant, some even failed to access prevention of mother-to-child programs as they had no access to healthcare services. So a lot of things happened to women living with HIV.
It becomes worrying when you speak to the issue of women actually disrupting their treatment regimen. We do know that there is talk that once you are on ARVs, you're not supposed to default because it's got consequences later on. Are you starting to see those, particularly for those who defaulted because they could not access a health center?
Defaulting treatment has consequences.
Yes.
Just like if one decides to put themselves on a drug holiday, there is consequences. It really affects the CD4 count and the viral load. The viral load will increase in the body, you know, because your body was used to a system of taking this treatment, controlling the virus during certain period of the day, and suddenly you disrupt, you go for 1 week to 2 weeks. It comes with consequences, and it can also result in a certain strain whereby treatment will fail to work, you know, because it was interrupted. So we don't encourage people, but I'm glad to say as Pan-African Positive Women's Coalition, we continue to make the noise, to make the advocacy, to ensure that our members, wherever they are, who need treatment, got that assistance for that treatment. Of course, we did lose about 4 members from COVID-19. They could not make it. They succumbed and they died.
Yeah, that was actually my next question, to then say, how has your sector been affected by COVID-19? Looking at someone with HIV and then getting COVID-19, we normally used to hear through messages where it's when you've got other illnesses and then getting COVID-19, it could be, it could affect you more, particularly someone with high blood pressure, cancer, you've got diabetes. So I really wanted to know the HIV situation and COVID-19.
Yes, from what we read and from the information that has been shared from reliable sources like Ministry of Health and Child Care, yes, those people with underlying condition, if they also get COVID-19, sometimes it becomes fatal than a person who doesn't have a condition. But anyway, I think more information, accurate and reliable information was being disseminated. And as Pan-African Positive Women's Coalition, we started documenting and packaging in weekly bulletins, giving updates on what women living with HIV were doing, in community voices, and in our Dandaro, the forum, we have documented these stories. And we have encouraged women living with HIV to also take up the COVID-19 vaccine. I got vaccinated myself, and I've already got my 2 jabs, and it's over 1 month, and I feel fine. And I would like to say, since I got vaccinated, my health has really improved. I do not feel anything. And I'm fortunate that I did not suffer even minor side effects. Some say they suffer a flu, etc., etc. I didn't. And as a result of this, I came out to tell my constituency and even ordinary people that these vaccines are safe. Just imagine the highest office, the vice president and minister of health was vaccinated, and we all got vaccinated. And we need to see more people getting vaccinated, because this is COVID-19. The only prevention is to get vaccinated, and the vaccine is safe to everyone, including people living with HIV and women living with HIV.
Indeed, the vaccine is safe to everyone, including women living with HIV. We'll continue with our discussion after the break. Our discussion continues, where we are looking at women living with HIV and COVID-19. Before we went for the break, Tendai was sharing with us that she was vaccinated, didn't have any side effects, and was encouraging almost all of us to actually go for vaccination if we have not been vaccinated. One issue that women often speak about, Tendai, is when they are pregnant, they are HIV positive. And any other ailment that comes, adding adding COVID-19 to the equation. Any of your sector that experience that, they are pregnant and then they got COVID-19?
Well, as we have depended entirely on reliable sources from the Ministry of Health and Child Care on women living with HIV who are pregnant and COVID-19, and the information that is there right now is that pregnant women are not being vaccinated for COVID-19. And from what we understand is that there is a research going on to see if the vaccine is safe for a mother who is expecting. That's the information that we have.
I do like the fact that you are emphasizing that we rely on reliable information, because I think as a country we have a tendency of just circulating any information that we have seen, particularly where we want to cause alarm. We are so quick to just circulate that. Zeroing in, Tendai, on your life as somebody living with HIV. You spoke in the first segment about the issue of stigma. And I would want to find out, starting relationships, finding a partner. How easy is it for women when they have come out to say, I'm living with HIV?
It depends who you are, who has come out. An ordinary woman who is in the support group, who has not disclosed publicly, it's very easy to enter into a relationships. For women like me, it doesn't mean that there are no men out there who like us. But vanotyira kure kuti uyo ndobva ndazongonzi neniwo ndiri HIV positive, because vachine shame iya. But people can enter into a relationship, and it's a choice. And I always believe that it's about liking somebody and loving them. The issue of their health condition, it's secondary, And for us, we have disclosed, kana munhu achitouya achizondi approacha anotoziva kuti ndo zvandiri, anotozenga akutongogara neni sezvandiri, handiti. Saka ndo zvazvingori izvozvo. Yes, we do have women living with HIV who say that they are not finding relationships, and some are saying if we enter into a relationship, despite the man not knowing his status, not being tested, the moment you disclose that you are living with HIV, they abandon you.
Yes.
You know, even you vasingazivi status yavo, sometimes they are already positive. But we do have women who have managed to get steady relationships. Some have managed to get married and wedded. Some have even managed to have children and start families. And some are in discorded relationships for many, many years in our group. We do have some who have stayed together for 30 years in a discorded relationship. So it just depends with any individual. Everyone would like to have someone in their life. But for a person like me, I think I'm too much married to this work that I do. I don't even have the time, even ndikati ndinopinda mu relationship andizoti munhu wacho ndompe.
You won't last.
I won't last because I'm always on my computer. I'm always working. I'm always talking to the women. I'm writing this. I'm writing that. I'm planning a program. I'm busy. I'm moving from between Harare and Kadoma. You know, we are based in Kadoma. I'm going to the rural areas, Kariba, Nyami Nyami, Zimba, Mondorongezi. I'm always everywhere. Saka nguva yacho, yondizopa attention to a person in a relationship. It has to be somebody who understands my life, who can tolerate kunzwisauti ndo life yangu, because I'm not willing to compromise my life for a relationship. I have been in them. I have seen it all. There is nothing new that I expect to see. I'm a grandmother now of 4 beautiful grown-up girls. So what more do I want? Now is the time for me to enjoy life.
And when we are looking at the elimination of mother-to-child transmission, how successful has that been for women in our country?
That the succession rate is very, very high. I think it's almost over 95%. A lot of women who are living with HIV who fall pregnant and they are put on the PMTC program are giving birth to HIV negative children. It's a very small percentage where a pregnant HIV positive woman can give birth to a HIV positive baby, but the majority are giving birth to HIV negative children. And this is one big successful program we have managed to do as a country, and I applaud our government of Zimbabwe for a successful elimination of mother-to-child transmission program to end AIDS in babies and keeping their mothers alive.
It's good to actually be witness to success stories. So what would you say are your key asks as people living with HIV, or as women living with HIV, your main concerns?
Our main concern is that we want women living with HIV to have easy access to treatment and also to other services of sexual and reproductive health. As you know, there's a correlation between HIV and cervical cancer. A lot of women living with HIV are succumbing to cervical cancer. We just don't want those pap smears, but we also want the treatment for cervical cancer as soon as one tests positive to cervical cancer. And those services to be more readily available, that a person should go at least twice in a year to be screened for cervical cancer. And we also want income generating activities for women living with HIV. Let them have access to loans to start small businesses for their own livelihoods, because once we remove poverty, it reduces the risk of HIV on women. And we are also asking for leadership spaces for women living with HIV in all spaces, be they in the civil society, in these boards, politically. We want to see women living with HIV participating in all those spaces. Yes, we remain apolitical, but there is no way it's written that in parliament one cannot enter parliament because you cannot stand to contest for a parliamentary seat because you are living with HIV. So we want women living with HIV to take up advocacy, to be in these leadership spaces. We want the meaningful involvement of women living with HIV in all spaces, from program planning, program design, program implementation, and program monitoring and evaluation. And then we say we have ownership. We are part of it. It's not tokenistic.
Definitely meaningful involvement of women living with HIV. That's a key ask. Coming from that particular constituency, Tendai, it has been a pleasure to have you on our program.
Thank you so much, Tariro. It was a great pleasure.
Until next week, it's goodbye.